I'm Dylan Mann, and this is WMNF Tampa.
The opinions presented on the Healthy Steps show are the evidence-based opinions of Dr. Fred Harvey, the callers, and his guests. These are not the opinions of the staff, the volunteers, or the board of WMNF. The information provided on the show is not intended to diagnose or treat any disease. There is no implied patient-physician relationship in these calls. The nature of the calls is educational and informational only.
Good morning, my faithful companions of the airwaves. Let me remind you personally that you are incredible, and also thank you for keeping your dial tuned to WMNF Tampa, the resistance radio station from Tampa Bay to the Gulf of Mexico, and the one and only discerning little radio station that Major would ever dare stream when he is not in his office. And you can stream us as well at WMNF.org. Today is Ask Me Anything Monday, so if you have any medical questions or concerns, just give us a little jingle at 813-239-9663. Once again, that number to call is 813-239-9663. You can also send an email to dj@wmnf.org or text us at 813-433-0885. Well, Dr. Fred, AMA always seems to allow you to bring out the best in our listeners. The well is always deep and full on AMA Monday, so let's dip in the giving cup to offer to your listeners and get this show on the road. Take it away, Dr. Harvey.
Let's get it revved up. How are you today, Bill?
I'm doing hunky-dory. Can't complain. It was a great weekend, quiet. How about you?
Glad to hear it. Same. Got to have a really nice brunch with Mom yesterday and just celebrate being able to enjoy some time together. So helpful for, just your overall well-being, to share some love with people you love.
Absolutely. And it sounds like it was a very kind of a communal kind of thing with your mom and I suppose others. So
my husband was there. It was a nice, small little brunch.
Happy for you.
Thank you. Yeah, she's 90 and pretty frail, so it's really nice to see that she can get out. So, in the news today, we're seeing that COVID is increasing. It's autumn, and we're working towards autumn, late summer, and that's when things start moving again. It's primarily in the South and the West. Florida definitely has an increase in cases, but nothing like back in 21 and 22. It's probably about 1.5% of the total numbers we were seeing then. But there's a different issue here, and that is that there's much less testing going on. So the numbers are probably higher than what is officially reported because it's tough to get numbers when people aren't testing. But, we do know that vaccination rates for coronavirus, SARS-CoV-2, COVID-19 have gone down. Only 17% or 17.5% of all adults apparently got a shot in the past year. And so that's well below the possibility of getting herd immunity and stopping this viral transmission. But I don't think we're ever going to get to that level. And fortunately, COVID's not as deadly as some other issues. And it seems that with ongoing immunization with some and reinfection with others, there's a level of immunity that's out there, but it's not preventing infection. But it seems that there's less people dying from it, but there's a lot less people getting the infection too. So it's there. And if you have health risk, you're still at risk. If you have age over 65, if you have any medical illnesses like high blood pressure, lung disease, diabetes, cancer, autoimmune diseases, you're at risk. And so your system is more susceptible to serious complications from any virus. And so because we know the statistics of relative risk in this group, it's recommended that anybody with those risk factors should consider getting your regular vaccines, like a flu vaccine or even a COVID vaccine. Now, there is an alternative available to the genetic therapy with the mRNA COVID shots. There is something called the Nuvavaxovid. That's Nuvavaxovid. And that's Novavax's spike protein vaccination. So instead of, as in the Moderna and the Pfizer shots, you have an mRNA sequence that's directing your cells to make spike protein inside the cells and deliver it to the body as an antigen, which is a protein or something that stimulates an immune reaction. The Novavax company uses the same mRNA technology to create the spike protein vaccine in the laboratory, and you get the spike protein shot into your arm. It's a very similar thing to some of the flu vaccines, which inject a piece of protein into your arm. Other flu vaccines are live attenuated viruses, meaning that they've been clipped. Their wings have been clipped. They can't really make a terrible infection, but they can give you the proteins that you need to see an immune response. But Nuvavaxovid is available at some pharmacies. I believe CVS, Publix, and Walmart carry it. So if you want to avoid the mRNA gene therapy, that is one way to do it. If you do get exposed to someone who has the disease, not general exposures like, go to a public place and think maybe somebody coughed near you. But if you're spending some time with somebody who is known to have COVID, you probably won't know it until after the fact, but within 72 hours of that exposure, there's a medication called Zocova, Xocova, and Citrelvir, and that is post-exposure prophylaxis for getting the disease. And it seems that by getting this within the first 72 hours, you can reduce symptoms by 67%. Still have the virus, but it will make it less intense. And this medication works like HIV antiviral medications. It's a protease inhibitor, so it inhibits the action of the virus in your body. And, coronavirus is a cold. 30% of all annual colds come from coronavirus. And coronavirus beta SARS-CoV-2 is COVID-19. And it's basically the same as all the other ones, just more potent, it appears. It triggers a different immune response. But, for most people today, you're going to get runny nose, congestion, sore throat, fever, mild, you'll feel like you have a cold. It's maybe worth it to get tested then. So you could get some Zocova or consider other therapies. But to avoid it, stay away from closed, crowded spaces. If you're going to go to a concert, do something like the amphitheater and be on the grass in the crowd where the air gets circulated much better. If you're inside, make sure that there's good airflow, a fan over your head, good air conditioning, something that keeps the air moving, because that does reduce the amount of exposure. And if you have symptoms, it's really courteous for you to wear a mask so you don't infect other people if you have to go out of your house. And I think we can be really rational and reasonable about this virus and just take precautions. And I think we can do pretty well that way. Public health isn't that complicated if we can apply some common sense. And if you want to talk some common sense, this is Dr. Fred Harvey. We're on the Healthy Steps radio show on WNF Tampa.
Yes, there, Doctor. You're such the optimist. I think the common sense isn't very common anymore. We do have Ben from... Yes. We do have Ben from Sarasota on the line. I'm going to make you wait just one more second there, Ben, while I remind folks you are listening to the Healthy Steps radio show with Dr. Fred Harvey here on WMNF Tampa, and I'm inviting you to participate by giving us a call at 813-239-9663, or you can send your email questions to dj@wmnf.org. Good morning, Ben. You there, Ben?
Hello, Ben.
Yeah. Hello?
How are you doing today?
Good, Dr. Harvey. Thank you for taking my call. I appreciate it.
You're very welcome.
Okay, so here's the scoop, Doc. It's kind of a long one. So about 3 years ago, I developed some severe stomach pain and bloating. I couldn't sleep at night. Finally, I was diagnosed with SIBO. So I was given some, rifaximin. And since then, I've had 5 reoccurrences in the last 3 years. Treated with rifaximin. The last treatment was about 2 months ago, and it did not change the hydrogen levels after the treatment. So a recent duodenal biopsy showed that I have lacking inadequate lactase, sucrase, and maltase, which I suspect is the result of having the recurring SIBO thing. So I'm taking some supplemental enzymes, which seem to help. I've lost 20 pounds in the last 3 years, and so I'm wondering if you got any suggestions of what I might do. I'm kind of at a loss now.
Well, the weight loss has happened because you've changed your diet or because of the illness?
Well, I guess a little bit of both. I have recently tried to be real restrictive in the carbs and sugars because I figured that's kind of triggering, the bacteria. So part of it's diet, but not. I didn't want to lose it. Let's put it that way. I'm down to 132, and I used to weigh about 150.
Yeah. So you didn't start overweight, it sounds like, and you've lost weight you didn't need to lose. And so during this 3 years, did anyone give you some dietary counseling about what to do to prevent it from recurring?
Well, I've been working with a nutritionist, and yes, she has helped, but, it wasn't very strict. I mean, I would still have a little ice cream in the evening, because I kind of figure sugars kind of trigger that.
Yes.
The bacteria, I think, loves the sugars. So I've been very strict the last several weeks, and it seems the bloating seems to have, dissipated a little bit.
That would make sense. A couple of things to consider is when you're trying to get a change, you in your microbiome in your gut, you really need to persist with it for weeks. And with SIBO, the FODMAP FODMAP diet. Monash University, MONASH University, has an app for it that is really good, and they update it all the time to help you avoid the foods that will actually help the wrong bacteria grow and make you bloat and get bacterial overgrowth again.
Yes. Doctor, what do you think about, since the rifaximin didn't work this last time, what do you think about this elemental diet? It's not something I relish to do, but that is an option, I guess, that would help eliminate the bacteria. But could the bacteria be eliminated with just strict diet?
Yes, actually, an elemental diet is a strict diet, super strict diet. But you can do it with going to a diet like the a general paleo-style diet, trending towards keto, but you don't have to induce ketogenesis. You just need to avoid eating the sugars and sugar starches that are FODMAPs because they produce the wrong bacterial growth. So if you're eating lean meat, lean fish, eggs, vegetables, low glycemic fruit, olive oil, olives, seaweed, things like that, nuts and seeds, you're not eating the things that produce the problem.
Right. And I have been, like I said, I've been pretty restrictive, and even on the vegetables, low carb vegetables, the last couple of weeks.
Good, because that's the direction to go. Now, when you had your breath test, did they find the methane
Oh, well, this is kind of weird because it's hydrogen dominant, which usually results in diarrhea, but I've been more hydrogen dominant with constipation. So
But the methane didn't show up?
No, methane's been very low, if at all.
Okay.
Yeah. So
Yeah, it sounds like you need better strict diet to help control this. I think it's one of the first things to do to make sure that you're, addressing the problem the right way. Give yourself 4 weeks of very strict diet, maybe 2 months, and see what has changed. You may want to see a functional medicine doctor and get more extensive stool testing than is offered by most gastroenterologists. It's really interesting that they don't do the deep dive on the stool testing like a functional doctor does, and I can't convince them to actually order the test.
Yeah. The GI doctor's office pretty much told me they couldn't do anything for me anymore, and recommended to go over to USF and see somebody. So that's kind of where I'm at now. I can't get in for a couple months, though.
You could get in faster, I'm sure, to a functional medicine doctor. Are you in Tampa?
Sarasota area.
Okay, yeah, there's lots of us all over the West Coast, so you might want to go to the Institute for Functional Medicine.org, IFM.org, and do a doctor search. See if you can find a good functional medicine doctor to chat with.
Okay, all right. Well, yeah, I'm like I say, I don't know quite what to do now. So anyway, well, thank you for your time. I appreciate it.
You're very welcome, Ben, and best wishes with resolving that SIBO.
Yeah, thank you. Bye.
Bye-bye.
Yeah, thank you very much there, Ben, and best wishes, as you said. I've got Pamela and I've got Anonymous waiting on the lines here, but I'm never satisfied with a half-full queue of callers, and Joe's never satisfied either. He's answering the phones for us today, and I'm very grateful for that. Joe's always so spectacular. But give us a call at the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa. Express your medical questions or concerns by calling 813-239-9663. Again, that number is 813-239-9663. Or continue to send your emails to dj@wmnf.org. And that little shout-out worked. I added Joe from Venice to that queue. Let's go to Pamela. Good morning, Pamela.
Hi, good morning, Dr. Harvey.
Good morning.
I'm glad that you brought up the Novavax. Actually, earlier this month, I spoke to my primary care doctor about it. I'm finally ready to get a vaccine, and no judgment, please. When this all happened in 2020, I was coming out of the cancer battle. I had been through treatment. I had a port in my chest, still wearing a wig. So I had just been through a lot of science. And
Yes.
I wasn't ready to do a vaccine and whatnot. So this year I'm finally ready. I always get the flu shot, but I don't want to get both vaccines together. How far should they be spaced out?
Well, I don't think they need to be, but it's fine if you get them spaced out. Maybe give yourself a week or two between. It takes 2 weeks for your immune system to ramp up the full effect from the one shot. So, if you want to wait 2 weeks until it's done with that job and move on, that's fine. Actually, Novavax is in the process of working with Sanofi Aventis, another European manufacturer, to do a combined flu COVID shot. So they're not worried about you taking them together. In fact, MMR is a triple vaccine for measles, mumps, and rubella.
Okay, so that's going to be great when they come out with the combo. Yeah, he said this sounded like this was the most similar to the flu vaccine I've gotten for many years. So I thought I'm ready to get up to the plate and finally do it. And one thing, semi off topic, I did one dose of Zepbound, the 2.5. I have about really only 30 pounds to lose. The only reason I qualified wasn't so much my BMI, it was the pre-diabetes. And I was shocked at the reaction. I felt like I had had a round of chemo the next day. It blew my mind how strong that was. That's being sent home to people to administer to themselves. But this is just my experience. And also within the first week after the one injection, I had hair shedding. So, needless to say, that's not going to work for me. But I know.
What was that injection again?
It was the starter, what they consider the starter dose, 2.5 of the Zepbound, the quick pen. And, I saw later, of course, where they show you on YouTube how you can cut the dose in half, because who's to say that 2.5 is the right starter dose? But just from the reaction, feeling like the chemo crash.
Honestly, the people that say that 2.5 is the right dose are the people that actually spent hundreds of millions of dollars on clinical research studies figuring out what the right dose is. So deciding that a different dose is appropriate should probably be done with medical professionals and not just to do it randomly on your own, because these doses have been studied in large groups of people, and that's how they came up with the numbers that they put in the syringes.
Oh, right. No, I wouldn't go, rogue and do that myself. I decided after that severe reaction, the hair shedding immediately within the first week. I did the shot Wednesday. The following Thursday, I had a little quarter-sized bald spot. I'm not kidding, on the top of my head after one shot.
I don't think this medication is appropriate for you, period.
No,
why wouldn't you try a smaller dose? Because you had that much of a reaction?
I only mentioned that because, that's some kind of hack that they have on YouTube, but that's not what the manufacturer, just like you said, is saying what you're supposed to do with the drug.
Yeah, if you're having a reaction, you should stop it, tell the doctor, and figure out what's next, because that's it's not a life-threatening reaction, but it's ugly, and you don't need to persist with that with this medication. Right.
Okay, well, I'm going to take your advice for wait the 2 weeks after the flu shot, and then try the Novavax this year, because I don't want to have a miserable fall and winter getting sick this year.
Yeah, I hear you. I think I'm actually going to opt in for the Novavax. Unfortunately, they are tough to find, and not all pharmacies cover them or carry them, so you have to look around.
Okay. I'll call the pharmacy that I use first to make sure they have it.
Very good. I don't think Walgreens carries it.
Yeah, I go to Publix usually for all my prescriptions and whatnot. So. And
they're showing up online as yes.
Okay, great. All right, well, nice chatting. Thank you.
And you.
Okay, bye-bye.
Thank you there, Pamela. And I've got Anonymous from Tarpon Springs with a Novavax question as well. And as I said, I've got Joe with a prostate question. But I feel exceedingly generous, and I'm going to give on out the phone number one more time to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa. Give us a call with your medical questions or concerns at 813-239-9663. Once again, for those of you slow of pen, the number is 813-239-9663. Good morning to you there in Tarpon Springs. What have you got for us?
Hi, I missed the actual name of the Novavax you were talking about, but if I were to go to CVS or Publix, do I just ask for the Novavax?
Yes, you would do that, and they should know that brand is something they're stocking, but the actual name of it is Nuvavaxovid, Nuvavaxovid.
Oh, lovely. Don't you? Yeah, Vaxovid. Okay, I got it, I think. You said one other one, CVS, Publix, and maybe one other place?
I think Walmart. I think Walmart was on there.
Oh, okay, great. Well, my question is, what about people with autoimmune disorders and, for other people's information right now in taking that? And for my particular one, it's psoriasis, so that's a little bit different from the other autoimmune disorders. Would you recommend, would you think that it would be a good way to approach COVID-Vac for someone with psoriasis?
Well, the CDC recommends anybody with any kind of medical illnesses like autoimmune disease to take the vaccine.
Okay, right. Can I seg into psoriasis? When I was diagnosed, I got zilch for information about it being diagnosed by a dermatologist, about it being an autoimmune disorder. I didn't know that it was for a year. And,
right.
And it's not, it's,
you just knew it. You just probably knew it as the heartbreak, right?
Not at all, really. That's
no.
Yeah.
You don't remember those commercials from back in the 70s? The heartbreak of psoriasis.
Well, even the ones current now are, a little bit ridiculous. Yes. And I couldn't count on the particular dermatologist I went to really address what I want. I even had a pharmacist when I was getting my COVID and flu vax a couple of years ago. She saw it on my hands and she said, "Oh, triamcinolone cream is not going to help." She wrote down, said, "Take this to your dermatologist or doctor and get them to prescribe it." Well, the dermatologist wouldn't do it. She wanted me to get exactly what they wanted me to pay for and get and go into. So,
ego is a real problem sometimes.
I know. Anyway, do you have some idea? See, I'm vegan and sworn, and never will change from that. Actually, for the majority of the last 30 years, but I also am totally holistic medicine oriented. However, I've never been able to consult. I'm so glad that you're here. Functional medicine or integrative medicine practitioner.
Sure.
For that matter.
So I have a question for you.
Please tell me. Yeah.
Since you're vegan, what is your source of omega-3 fatty acids?
Okay. Currently, because I have. I'm taking is it okay to state brands?
It's okay, but what's the substance you're taking?
It's a combination of evening primrose, flax, and borage. I think maybe not borage. It's the three. I was taking an algae-based one, but algae and fungi don't work very well in my body, so I've switched to. I'm not looking at the bottle of it right now, but it's a three combination. Plus, I use a lot of ground flaxseed in my diet.
Good.
I prefer it to oils.
That's a great thing to be doing. And one thing, since you are doing those vegetarian sources for your omegas, you might want to get an omega index from Quest Laboratories at your general doctor, because it's available at Quest. It's easy, and then you can see if you have enough, because one of the foundations of, from my perspective, dealing with any autoimmune disease is to make sure you have enough omega-3 fatty acids to stabilize your cell membranes.
Right. I understand. Okay, so Quest can do a test for that.
It's called the Omega Index.
Omega Index. Okay. This is going to be helpful. And any other things you can. I approach everything about my life. The only time I've had any antibiotics in my system was when I had to have pre and post cataract surgery. That was primarily gentamicin, but I don't do antibiotics. I have a plethora of tinctures and homeopathics. I go all that route. So that's where anything that you could help me with at this point, and this is going to be one step. Anything else you might be able to mention where I can? It's mostly controlling just the outbreak on the skin for me right now.
Well,
but
I would avoid most rice products, brown rice especially. They're very high in arsenic, and you might want to go to like Lundberg rices because they're the lowest. Great Value actually has a couple of longer. Basmati rice I think is one of them, but. Soaking the rice before or rinsing it before takes some of the arsenic away. But arsenic actually creates skin rashes. So you may want to just look at that. And other grains, gluten and other grains can be irritating. So if you're vegan but not gluten-free, you may want to consider that too. But first things first, make sure you have enough omega-3s on board to control the inflammation.
Right. Okay. And that's another thing. In conjunction, I've been wondering all along. I got diagnosed right shortly after or around the time that COVID struck, and I thought, I didn't know enough about it. Am I, conjunction with taking any of the vaccines, COVID and flu, and I did do COVID and flu and whatever it is, the lung one, the other one. But I'm wondering how that works with my immune system difficulties, if you will. So it still would be recommended to get the vaccines.
Yes, it would be.
Okay. And then, okay. It just, I thought, if I get a cold, I'm not going to be able to treat it with antibiotics, you know.
Well, you don't want to. You want to treat a cold with fluids, rest, some good chicken soup, and maybe some vitamin C. No, chicken soup, actually, there was a pulmonologist.
I've been a vitamin C user for probably 50 years now, so that's
excellent.
One of my best ones.
There's a pulmonologist out in UCLA that did a study about 30 years ago where he took his grandmother's Lithuanian chicken soup. It had all these root vegetables in it, pureed. Yeah. It was an amazing soup recipe. But he compared the people who he gave that to the people who didn't. And the ones that didn't get it had more inflammation in their lungs on a scan that they did after the administration of chicken soup. So chicken soup actually calms the common cold and keeps you from getting lung inflammation.
I'm afraid I'm not going to break my vegan, the whole, you know.
You don't have to.
I want a diet. That is my all-time diet. What I put in my body is going to be primarily vegan and organic and et cetera, et cetera, et cetera. But I'm taking up too much of your time for the next person to get in.
That's been a lovely talk. So
this is you're just such a great help. And do you ever? Can I ask this quickly? Can I talk with you on the phone professionally and not Zoom?
We can do phone calls. Yes, you can just call my office and we can set up a phone consultation.
Okay, great. I'll bear that in mind. Okay, thank you so much, Dr. Harvey. You're a great help to all of us. Thank you.
So glad to help.
Yes, indeed. Thank you very much. And let's go to Joe, who's been waiting patiently in Venice. Good morning, Joe.
Good morning, gentlemen.
Hi there.
Hi. Hey, could you just, I'm 69, male. I eat red grapes and spinach, and I take fish oil, and I try to eat good, in other words, and I drink green tea. Green tea with mint in it is fantastic if everyone's trying. Anyway, I'm concerned, what's good foods and drinks for prostate health for an older male?
Oh, that's a good one. I think essentially it's the same foods that are good for everybody and every organ all the time. The Mediterranean diet is the diet of humans. And the Mediterranean diet is a plant-forward diet. It is a plant-based diet, but vegans have adopted the plant-based thing to describe them many times. But plant-based means that you have a predominant of your calories and food coming from plants. Like 80% of your plate should be plant, 10 to 20% animal if you're going to live by the blue zone / Mediterranean kind of rules. And those include, for someone who's, say, 150 pounds, 7 to 9 servings of vegetables, leafy ones and solid ones, every day. 2 servings of low glycemic index fruit. Maybe 1 serving of grain, 1 serving of starchy, or maybe 2 servings of starchy vegetables like beets and potatoes, sweet potatoes and squash, and then probably about 10 ounces of lean meat, fish, eggs, or tofu and beans for someone who is trying to lean away from more animal product, and beans on a daily basis is something most of these places actually get a little bit of. They're great for your microbiome. So that's a great way to start for anybody. And then some seeds, like pumpkin seeds, have some great oils and some zinc that are great for the prostate. The rainbow of antioxidants that comes in your fruits and vegetables, especially the darker berries. These have great fat-soluble antioxidants that help fatty tissue like the prostate.
Okay, sounds great. Thank you.
You're so welcome.
Okay, bye-bye.
Take care, Joe.
Thank you very much there, Joe. And let's go to Ann in Land O'Lakes. Good morning, Ann.
Hi, yes. Thank you, Dr. Harvey, for taking my call.
You're welcome.
My call is in reference to my 97-year-old stepmom. I've called you before in reference to other things, but anyway, she has I don't know the technical term, but she has a bed sore on her bottom that will not heal. She's had it since last Thanksgiving. She is in an assisted living facility, a very nice one. It is very deep and big. They've done all kinds of treatments. She has been in, they don't have a hospital, but a medical center for months and months. She got MRSA for a while because of it. She is incontinent. Now, this is what we're doing now. Okay, her hygiene is taken care of every day to make sure she, bathes and takes care and changes and et cetera, changes her clothes, is dry. She is now on a wound vac. They did an MRI and they can't find any other complications. So it heals, but then it stays at a certain place and doesn't get any better. One of the problems is that she chooses not to move. She stays in her recliner. She shows a lot of symptoms of depression, understandably. And she is very mobile. She's got exercise class. She walks around. She has a walker. She's very cognizant of, she knows what's going on. Mentally, she's right there on top of everything. So it's not anything to do with that. So my question is, she's back in, she got out for a while, but then she's now back in the medical center, which is very depressing, obviously. And she will not move, no matter what the incentive. She's on a special cushion, et cetera. But anyway, what else can be done? Can I request she hasn't had a physical either for like about 2 years.
So she's been in the medical center specifically for the non-healing pressure ulcer.
Correct.
Okay.
That's it.
So
she's healthy every other way. There's nothing else wrong with her. Nothing. That's the only thing.
Yes. My suspicion is that she has extremely poor protein intake in her diet.
They do give her a protein supplement every day.
But my question is she actually eating enough protein to maintain her systems?
Yeah, she doesn't eat very much.
Right. And I know what happens when you give 90-year-olds their protein drink. They drink 2 sips and decide they don't want it anymore.
Yeah, this one's concentrated, and I watched the nurse give it to her, and, she has to drink the whole little cup thing. I don't know what it is. I can find out. But
little cup thing? Like, how big is the little cup thing? Dixie cup size?
No, a little medicine cup.
Oh, that's all?
It's not the teeny ones.
That's not a protein supplement. That's something else, because there's not enough protein in that little thing to actually do anything for her body. So the key here is that she probably has protein malnutrition, and with protein malnutrition, you cannot heal tissue. And she probably doesn't eat enough vegetables or fruits to get enough vitamin nutrients to assist the healing. And so it's not unlikely that this is going to not heal because she's not going to get enough energy to heal it.
Okay. And she doesn't hardly eat at all. And she takes they give her a multivitamin, but I'm always encourage her, you need to take omega-3s, we need to work on your vitamin D, maybe for depression,
that's a nice song and dance you've done with her. And I've done the same one with my mother, who has about 8 bottles of stuff that she said she would take, but she doesn't. I love her, but there's just not a possibility she's going to take a fistful of pills. She hates swallowing pills. She's not going to do it. And so she's going to do what she's going to do. Fortunately, she's learned to eat more food. She's happily eating more food now. She was on a bit of a she was really stressed out with caregiving for my father, and she wasn't eating and taking care of herself, and she had similar things happening. Your mom's 7 years older, or stepmom, and she's not likely interested in having any more food.
No. She's lost her will to live. She doesn't have any purpose. She's in this place.
Right.
She's lost all of her interest. She doesn't do anything anymore. She used to be very active and then mentally active even. She's not even doing her puzzles or, all that kind of junk that she did. So,
Yes.
Okay, so we encourage her to eat more protein, and I've been with her, and she used to eat very healthily. She never has really, but not bad, but she just, but, it's so sad, and it's so frustrating, and, and there's nothing else wrong with her, and here she is, except that she's very sad, obviously, and
Yes.
so,
So, best wishes coaching her to do a little bit more, but I think that at 97, she's just struggling to stay on the planet.
she is, mentally, mentally. I think. Yeah.
Well, yeah. I mean, she's lost all of her friends. She's warehoused in a place where, these aren't her family or her friends. She feels terrible. She doesn't move. She doesn't want to eat. She wants out, just like my dad wanted out.
And she said that. And she has said that. So the fact that she said that, and, of course, I reported it, to the nurses and, then her family, her two children, got all upset because I did that and, blah, blah, blah.
Well, I'm not really sure that it's actually depression. It might just be realistic thinking, like, what do I have to live for? I don't know that that's actually clinical depression. She's sad because she has nothing. I mean, how often do her children hang out with her? And there's like, it's a terrible space for old people in this world now.
It is, and the sad thing for me, and because I know it doesn't have to be like this. I've gone through similar stuff, and it doesn't have to. Her life, and her end of her life, doesn't have to be like this. But what can you do? You can't change people. I can always encourage, and educate, and but and I'm also fighting, of course, of our family. So, yes.
Yeah, and sometimes people don't want the education. You have to be invited in, and fortunately, all you people invite me into your living room or wherever you are to educate you. But there's a lot of people who don't want to hear it, and so
Yep, I've been told that.
it's not your job. It's not your job. Just be compassionate and understand that people are going to do what they're going to do. And that's, I had to learn that in 1987 in my second year of medical practice. Be compassionate. People are going to do what they're going to do. You can't own their problem, and you can't control their response to what you tell them to do about it, and you can't control the outcome. So just step back and watch how it all unfolds.
Right, and just like you said, be empathetic and compassionate and support her where she's at.
That's it.
Yeah, okay. All right, thank you, Dr. Harvey. I appreciate the feedback and the information and the time. Thank you.
You're welcome.
Bye-bye.
Thank you there, Ann, and best wishes to you and to your mother and your stepmother. Let's go to Lainey in Carrollwood. Good morning, Lainey.
Hi, good morning, Doctor.
Good morning, Lainey.
I had a question. But before I had the question, I wanted to piggyback off of what this lady just before us said.
Yes.
My mother was 92, and she stopped eating because the children had moved farther away. She just, as age, she started eating less. And we called in a swallowing study, a speech therapist. And what she trained us was that the less they chew and eat, the less they have the ability to swallow. And then when they don't swallow well, they unconsciously refuse, like the turkey sandwich, and they just go to the, drinking these shakes. And also the depression, of course, you're sad when you're that age and you see you can't do as much as you used to. It's normal. What we found to help was making a schedule for family members to sit with her at mealtime. Somebody sat at dinner. Somebody came by at breakfast in the morning before work. One of the grandchildren stopped in at lunch on their day off from school and on the weekend. And just the connection of eating with somebody and allowing them to chew slowly and swallow. She started to get her swallowing ability back, which I noticed was getting diminished.
Yes.
And she lived 3 more years after that, where at one point a doctor had said to us, a hospice doctor, well, they just stop eating and that's the end. Well, it wasn't. We made sure we were safe in the way she swallowed with the the swallowing study. And then we started the human connection and the visiting is what really enlivens that. But my question is, when do I get, I've had the Pneumovax shot. I've had the Arexvy shot for the respiratory viruses. And I have the, what do you call it, shingle shot.
Yes.
I've had all of those. And now the new pneumonia shots are coming out. And I don't know when I'm allowed to get a new one on top of the ones like that I had like 2 or 3 years ago and one that I had almost 10 years ago. I never get sick since I've had the vaccines. I believe they're safe, and I have autoimmune. I'm hypothyroid, and I also have vitiligo because of hypothyroidism, which I use Opzelura for, which works. And I'm a high Mediterranean diet, olive oil on everything, no dairy, no gluten, and no inflammatory foods. I follow an interstitial diet just because of the low inflammation. But I really want to get these new super duper pneumonia shots, and I don't know if I can. And the pharmacists that I go to see, they all give me a different answer. And that's the.
Well, I don't think you need a new pneumococcal vaccine for 5 years after the last one. That's generally what the CDC has recommended in the past. It may have changed. I don't know what one you got last time, but yeah, that's probably a sufficient amount of time to wait. And it really lasts a long time. It's a different kind of thing than a virus because the pneumococcus bacteria doesn't change much.
So what's the new one that's coming out? Like, how is it different from the one I got, say, 6 years ago? Or
they just keep reformulating them with different amounts of protein pieces. There was a Prevnar 23 and a Prevnar 13 and different adjuvants and different amounts for different strengths. And so, they just keep trying to tweak it so it's a little bit more effective. And then it hangs out under a patent for a little bit longer so they can charge full price.
Because I'm 65 and it's covered by my Medicare, but I do remember getting a 13 once a really, really long time ago, more than 10 years ago. And then I thought I got a 23 like 5 years after that.
That's probably the latest one you got. But in any event, the last one, I'd wait 5 years after it because there's no rush for you to get there.
Okay. All right, thanks. So it's not bad if I get another one on time in 5 years because I have asthma. So when I get sick, any kind of respiratory, I'm 5 weeks at home crouping and in bed and loose. It's really smart for somebody like you with respiratory stuff. It's so smart to take your respiratory vaccines. All right. Thank you. Thank you very much.
You're welcome.
Well, there, Doc, it's gone quiet here, and we've only got about a couple of more minutes left anyway, so I don't want to give false promises to anyone. And I do know you've got a batch of emails that you've been looking at, so what are you looking at?
Well, right now I have a text from someone, anonymous. Hi, Dr. Harvey. So many are reluctant to get the COVID vaccine due to the mRNA, and now that we have a flu vaccine with an option for mRNA. I'm speaking to this, but those avoiding mRNA, what options do folks have? Well, I just talked about them. All of the flu vaccines, except for the new one, are not mRNA vaccines. So ones I think flu block is one, and I'm talking about potent ones for people over 65. These are the most important ones. So flu block is one that's available currently, and I would consider getting. I've gotten the flu block in the past. It's highly effective and very safe. And so I don't know much about the mRNA flu vaccine, but since there are numerous other flu vaccines, I wouldn't bother with having my cellular machinery co-opted by some genetic instructions. I'd rather just take the stuff that was manufactured outside my body, which has been proven to work over the last 50 years, rather than the new technology. Here's one. Greg asks, good morning. Could the doctor weigh in on his thoughts on taking a daily high-quality creatine between meals for brain and cell health? This has been specifically recommended for my middle-aged friend's health profile and her specific health issues. Actually, 5 grams of creatine on a daily basis has been shown to help with, exercise, and improved mobility in people with Parkinson's disease. There's some evidence across the board for some increased benefit in many people. So I have no problem with taking 5 grams of creatine a day. I wouldn't do more than that. I don't think you need more than that. The evidence is not showing that you can benefit from much more than that. And let's see, here's one from Melinda. Hello, Dr. Harvey. I avoid Botox and other facial treatments because I was diagnosed with multiple sclerosis years ago. Well, I would avoid Botox for vanity for anything, because Botox is a chemical whose intention is death. The botulinum toxin created by the botulinum bacteria that causes botulism and kills people in food poisoning is something that, unless you have a real medical reason for it, like spastic dysphonia, which actually is improved because the Botox relaxes the tight vocal cords that do that. And so there are medical reasons to treat with Botox, but for getting rid of wrinkles, I think it's an excessive poisoning of your face. I was doing microneedling with PRP topical using my own blood, but last place said my PRP cells are old. They want to use exomes. Could that be dangerous for MS people? Well, honestly, I think that a lot of people are selling a lot of invasive interventions that are unnecessary. And so I think we need to rethink the amount of things we do for vanity, because I think we're doing a lot of invasive stuff just to cover up the real us. What's wrong with a wrinkle? Do you really need to have a skin on your face stretched so tight you look like you're a dewy 20-year-old when you're 75? I think it looks quite weird. And it takes a lot of maintenance to keep that looking that way. And I'm not interested in spending my time trying to maintain a look that isn't real. And it's just an opinion. But I probably have triggered a few people. And I'm sorry if I have, because honestly, I just don't think it's worth it. I'm not going to get any plastic surgery. I'm bald. I don't need to get a hair transplant. Our bodies are designed to change over time. Change is real. Change is necessary. And so, yeah, I'm willing to have a few hair follicles die and look like I do. But everybody has their own needs, their own desires, their own choices, and I commend you all for making them and sticking by them. That's all there is to it. So I want to thank you all for calling in with such great questions. I really enjoyed our engagement today. I want to thank you, Bill, for again, managing the boards so nicely. And Joe, thanks for picking up the phone and talking with all these lovely guests.
And thank you, Dr. Harvey, for another informative and rewarding Healthy Steps radio show. And thanks to all of our participants, listeners, and supporters. You make this show exemplary. You have been listening to the Healthy Steps radio show with Dr. Fred Harvey here on WMNF Tampa. Waiting for you like a dear friend is 5 minutes of NPR headline news, and then get ready for the Sustainable Living Show, hosted today by Annie Ellis. So until next Monday at 10 a.m., thank you for supporting and listening to the Healthy Steps radio show with Dr. Fred Harvey here on WMNF Tampa, your community conscious radio station. Stay safe, Stay thoughtful and know that you are loved.